are these things appropriate for? And what would be like your ideal avatar of a human who comes and you're say, yes, like you meet with them and you're like, this is 100% appropriate for you.
Yeah, so the way that so the prolotherapy, the PRP, and the stem cell therapy are all hitting at common pathways of reinitiating that healing response. And so my personal experience is that all of these can be indicated for an individual person. It just, the strength of each of these is very different. So if we have somebody who comes in and let's say they just chronically roll their ankle, let's say they had a real bad ankle sprain back in high school playing basketball, and then they just a few times a year they roll it. It's a little achy, and PT hasn't really helped, and they want to take care of this. You do not need stem cell therapy for that. That is way overkill. You're going to overpay for something that a honestly a dextrose prolotherapy would probably work really well. And I've had a handful of cases where we just do one treatment and that's all this person needs because we just strengthen that ligament a little bit and it no longer rolls. And now they can get back to doing what they want to do. On the other end, if
I
you
just
have
want
some,
to stop right there and say that's amazing.
yeah,
That's miraculous.
yeah, it's really fantastic. On the other end of the spectrum, someone comes to you with end-stage knee osteoarthritis. It's grade 4. They've been told they're bone on bone. In reality, they still have lots of cartilage, but they have end-stage arthritis. They've been told they need a knee replacement, and they are choosing to try something else. Prolotherapy is not the right approach because while it can get you there, it is going to take so many treatments to get there that this is where you're looking at either a really high quality PRP injection or a bone marrow procedure like stem cell procedure. So the ideal patient is really someone who has tried good physical therapy, because I am such a believer in physical therapy. I probably talk about physical therapy on Instagram more than any other regenerative injection doc out there.
I can say that you.
Because it's just there is, as you guys know, there's a wide range of quality of physical therapists out there. And someone tries one physical therapist who didn't know what they were doing, didn't have a clear diagnosis, made them worse, and they just go, yeah, physical therapy is not for me and I'm out. And so
Dentistry is not for me. I'm out.
yeah.
Okay. I just don't believe in dentistry.
Yeah. And so ideally it's someone who is educated on that there are alternatives out there because these are cash-based procedures, and so it's generally harder to get somebody to have buy-in if this is the first time they've ever heard about this procedure. So which is why I educate a lot to try and help people be aware of this. And then they have tried other things and hopefully it's non-surgical, but we have a lot of patients come through being like, I had surgery, it did not work, I'm still in pain, and now we've got to deal with that. So they've tried physical therapy, and either physical therapy is making them worse, and hopefully they've tried a few different physical therapists, or physical therapy is just not getting them to where they want to be. It's helped them, but they've plateaued and they just can't kind of break through that.
Yeah, I can't. There's nothing I can do to resolve primary instability of a joint. I can give you movement control and I can help you manage all the banging around and I can give you strategies to slow down. But if you're unstable, you're going to be unstable.
Yeah, and I tell a lot of patients that, because we deal a lot with neck instability from whiplash. And patients will sometimes ask me, can I just do physical therapy for this? And my general answer is yes, you can. But what we don't know, and we won't know unless we ever try, is some people can regain muscular motor control. They can increase muscular size and strength such that the fascial system can compensate for the ligamentous instability. And in some people with mild whiplash instability, that is okay, and they do great and they do fine. But at some point, there is a tipping point where no amount of physical therapy can help you to regain the severe loss of stability because those ligaments are just not doing their job. And so that's a great place where then the injections can come in, because now we can help them to regain stability. And then they go back to PT again, because I'm so bullish on PT, they then go back to PT so that way they can continue getting stronger, more stable, and then be at the best of both worlds.